Good afternoon, everyone, though it depends on your time zone, how late in the afternoon it is. And for a few of you folks on the West Coast, it's lunchtime or this morning. My name's Leah Nord. I'm Senior Director of Workforce Strategies and Inclusive Growth here at the Canadian Chamber of Commerce, and I'm really delighted to be moderating this session today. I'd like to, as always, thank all of our CBRN sponsors who are up here on the slide this afternoon, and today to thank in particularly webinar Sun Life Financial. Delighted, I mean, we're quite fortunate this afternoon to have Carmen Bellows as our speaker. She's the Director of Mental Health Solutions at Sun Life Financial. Registered psychologist and holds a master in counseling and psychology. Extensive experience in the field of psychology, including community and workplace mental health. Locally and nationally on numerous mental health related topics for both business and the greater health community. Actively involved in provincial and national working groups, mental health and related topics. Contributor to the mental health strategy at Sun Life and is a member of the board of directors at the Canadian Psychology Association. Hand it over to her. She'll do a presentation. Again, we'll open it up to questions and answers. And I just have to thank you and to say, you know, if this issue hasn't been timely over the crisis, I'm sure, you know, all participants here would agree when we say it's even more timely. It's becoming increasingly important as you know, the crisis continues, but as we also move into reopening and recovery. I thank you, Carmen, and I'll give you the floor.
Thank you so much. First, I just want to clarify that actually my term on the board of directors of the Canadian Psychological Association just ended. No, just for full disclosure, but thank you so much again for having me today. I'm really looking forward to speaking with everyone. So today we're really going to talk about supporting employees through COVID. So one of the things that we've really come to realize is that it's been several weeks since Canadians have been in isolation, and the COVID-19 pandemic continues to take a toll on all of our mental health. A Sun Life survey conducted between April 29th and May 1st found that the majority of Canadians say that COVID-19 is negatively affecting their mental health. Just as worrying, 60% say they're not receiving treatment or social support. And the top reasons for not receiving support are affordability, not knowing where to go or who to ask for help, and embarrassment or feelings of stigma around asking for help. So I think this really goes to set the scene for all of us to have a better understanding of why this continues to be such an important topic. So, as employers and people managers, supporting the mental health of our employees is more important than ever. The additional level of stress of the pandemic may not be sustainable for many. The risk is that your employees may become overwhelmed and unable to cope. Over time, this can diminish their capacity to do their job and carry out the responsibilities even in their home lives. The risk is very real and very concerning, and one that many of you have already been seeing play out in your workplaces, I'm sure. So really, what can you do to help provide employees with the support that they need to cope during the pandemic so that they can stay healthy, engaged, and productive? So we need to communicate with them. Employer empathy can relieve emotional stress, acknowledging that times are different and our emotions will be different too. No one is alone and that we all feel the impact. It's normal to experience a range of emotions. So for some individuals, this may include a feeling of helplessness. For others, it may be anxiety. For some, sadness, frustration, and even grief. Now, it's important to recognize that the individual situations of each of your employees will certainly contribute to what their experience is. For some individuals, grief has been manifested as a result of loss of experiences. People have had to cancel and change weddings. For individuals who wanted to host funerals or other types of ceremonies, they've lost the capacity to do so. And this can be a real loss for individuals, as well as celebratory things such as graduation and other life events. Overall, we may all find that we're both feeling frustrated as well as exhausted by the length of time that this has continued to go on. So it's important as a leader to continue to open the dialogue, to let employees know that it's okay to feel anxious. And this can be done by sharing your own feelings and struggles. This helps to validate your employees' feelings, including their stress, fear, and anxiety. But emotions like anxiety can manifest in different ways for different people, and concerns will be different for everyone. For some individuals, they're having health or financial or relationship issues, and we need to understand their concerns that they may be different from your own. It's important to recognize that right now, for people with their children out of school, this is an expected thing to be going on. Summer holidays, we know our children are out of school. But the stress and anxiety lots of individuals are facing when considering what to do with their children going back to school in the fall is a real strain on many individuals, as is the strain for many individuals dealing with the concerns around their own family members, elderly members, and people in their own community. So acknowledging your own struggles is not actually a sign of weakness, but what it can do is really open up the opportunity for other people to clearly share what they've been experiencing. Staying connected is also a vital part of leadership during this time. Recognizing that the relationship and the culture of your workplace pre-pandemic will contribute to the relationship you have with your staff in and out of the office during the pandemic. It's not realistic to think that you can significantly depart from the culture and nature of the relationship that you had pre-pandemic. You may need to focus on a few key things. Having frequent touch points with your employees is paramount. Being on the lookout for early warning signs of employees struggling is now more important than ever. We're all experiencing heightened demands, and understanding your employees' unique circumstance is important. If you and your staff are working from home and not having frequent in-person interactions that you normally would, creating time to connect will need to be prioritized. Having consistent and frequent contact with employees over the phone or virtually, both one-on-one and in groups, is critical. Oftentimes we're missing the idea of group conversations, but this can be important to really cultivate support and understanding, and for people to understand where their colleagues are at. If you and your employees are remaining at a worksite, it remains important that you're staying connected with regular touch points for the same reason. We need to reflect on how you connect with your employees right now and consider formalizing more frequent touch points if you've not already done so. Part of this is employees, when they know that they're having regular levels of communication, it can be really helpful. The absence of information can create significantly increased anxiety. And as such, we want to continue to have that regular, consistent communication, even if we may not be communicating new information, but just continuing to validate the individual's experience and then understanding of what's going on for them. So you as a people manager play an important role. Managers are ideally situated to be the first responders in helping employees who may be struggling. Generally, managers interact with their employees on a regular basis. They're familiar with the employees' job duties and their personalities, as well as understanding the workplace culture of the organization. So how do we know if someone is struggling? What might we see? And if we see signs of struggles, do we know what to do? It's reasonable to avoid such conversations over fear of making things worse or not having the answers, but we can't afford to do that, especially during times like these. Knowing what is available for supports will help you when faced with having to tackle these important conversations. As a manager, you're responsible for managing poor performance regardless of the source. Creating a healthy work environment is paramount and prepares us when performance issues may arise. If possible, providing support for individuals to remain engaged in the workplace can be important, as it provides them with ongoing support and structure, which may prevent decompensation that could occur at home or not working. Recognizing that work in and of itself is healthy. Work provides us with structure, it provides us with meaning and a way of organizing our day. Even though sometimes we all think we'd like to be independently wealthy and not work at all, recognizing that work really can be a healthy part of what we're experiencing during this time. So being away from work and not engaging in any sort of structured activity can actually exacerbate people's anxieties and even their illnesses at times. You may suspect that an invisible health issue, such as mental health, familial demands, financial stress, or physical illness, may be impacting your employees' performance. But you simply can't make assumptions about what the cause of employees' changes in performance are. Your job as a manager is not to diagnose or pry into the employee's life, but to have a positive dialogue around their decline in performance. These should be the observable, objective, or measurable changes that you've observed in their performance. You need to be knowledgeable of the supports and resources that might be available to them to help close the gap between where their performance is now and where it needs to be. This can be done in a number of ways, from accommodating a flexible schedule to skills training or coaching. But again, we really want to focus on acknowledging what has changed. What have we seen that is different? And what are those gaps? And how are we going to work with the individual to close those gaps, rather than focusing on what the individual themselves may be experiencing? It becomes important to really understand how we can tell when stress becomes more serious and requires closer attention and a more formal support. The symptoms and effects of heightened or chronic stress fall into 4 common areas. So the things that we generally see when individuals are experiencing some mental distress are first mood. So what they may be experiencing is a level of irritability, sadness, apprehensiveness, or loss of enjoyment. Now, we may not understand what another individual is seeing, but what we want to look for is what does that affect in the work that they're doing? So are they having more conflicts with their coworkers than they normally do? Are they avoiding difficult conversations or providing avoidance of their work in general? Thoughts. Is the individual presenting as poorly motivated, withdrawn, or helpless? If so, they may be experiencing an increased level of self-criticism or negative thoughts. Their mental processing is another thing we want to watch for. If an individual is having a reduced level of productivity, there's increased errors in their work, or there's an increase in efficiency, we may want to be aware that this may have to do with a slowing of their mental processing, such as poor concentration, memory problems, or indecisiveness. And finally, we always want to pay attention to the physical situation. We want to watch for when people present physically different than they normally would. This may be representative of sleep changes, changes in their eating, low energy, or overall agitation. Now again, we want to ensure that when we're documenting and looking at these sorts of changes in someone's behavior, we're not making assumptions and we're not approaching them saying, you know, I've really noticed there's a problem with your mood. What we want to do is really stick to the observable things that we're seeing. I really noticed that you're avoiding conversations and these deadlines have not been met. There seems to be a lack of performance when it comes to the spreadsheets that you've normally done, or these are the errors that I'm noticing. Making sure that we can tie those conversations to specific and observable conditions is extraordinarily important. So how would we actually do this if we've noticed these things? So one of the easiest ways to do all of this and have that conversation is something we like to call the check-in. And this is a meeting. We want to use the language of performance management to collaborate with the employee and approach the concerns specifically related to change in performance and behavior. One of the most effective ways to try to peel back the layers of work-related issues is with an employee is the check-in. The check-in has 2 objectives: to continue to connect with the employee in order to understand how they're doing, and to become aware of any invisible health issues that may be impacting their work. So let's take a closer look at what this relatively simple process entails. And we'll think of a client, or we'll think of one of our employees. Let's consider someone and we'll just call him Mark. And he's a normally exemplary employee, maybe who's now not been performing up to his normal standards for some unknown reason. So here are some steps and events involved in a check-in using Mark as a case example. First, we want to schedule a private meeting between you and Mark. We want to give him advance notice and provide him with the context or information about what the meeting will be about. We want to give a meeting a name that is sensitive, like one-on-one or check-in. rather than something that might cause him more difficulty, like meeting topic, performance issues to be addressed. Clearly, that would increase an individual's level of anxiety. And we want to really make sure that all of this is done in the spirit of collaboration. So, first, we also want to ensure privacy and confidentiality. We want to hold the meeting in a private, quiet place. If you and Mark are still at the work site, you'll want to find a private meeting. If you and Mark are working remotely during the pandemic, you can video conference. But it's important to ensure that you are in a private place and the employee is as well. And this can be a little tricky. If you notice that the individual has not had privacy when interacting with them over the video conferencing at home, you may want to consider speaking by phone instead. It's really important to ensure that level of privacy in order to be able to have that collaborative conversation. Next, we want to introduce the meeting. We want to let them know that we want to check in with them to see how everything is going. We want to ask questions in a sensitive way and invite them to share with you how they're doing, how they felt about work lately. Importantly, we want to ask them how they're managing COVID-19 and the additional stress and concerns that it brings. We're all experiencing additional stress and concerns, and it's important to give your staff an opportunity to clearly discuss what their experience is. Mark may disclose that he's struggling and may even reference some of his work performance issues. Depending on the individual's response to your questions about COVID-19, you may still need to outline some of the changes and performance issues you've observed. In addressing the changes you've observed, you can be honest and upfront, but caring in your approach. Take a balanced perspective. Make sure to talk about their strong points and contributions and let them know that they're valued. Again, collaboration occurs when we're able to have an honest conversation and provide clear and concise details of what we're talking about. We don't want to pry or ask personal questions. It's not appropriate or within your rights to ask individuals to answer questions about their personal life. Although you should be open to listening to what they have to offer, you should not ask for additional information, like, are you seeing a therapist? We also want to avoid making assumptions and give the individual time to respond by using open-ended questions. Oftentimes, when we're in a position of leadership, we want clear, concise answers. But in these sorts of conversations, we really want to be tentative and supportive, allowing the individual time to respond. We want to offer support. We want to ask if there's any way we can support this individual to show that you take part responsibility for their ability to be successful in the job. We want to ensure that we're giving the individual all the supports that they need to go from where they are now to where they need to be. We want to tell them about the resources that are available to support the employees that are offered by your organization, such as if you have an employee and family assistance provider or a benefits plan. As a people leader, it's extraordinarily important that you be aware of what the resources are for you. If you have an employee and family assistance service and you've never phoned, I would encourage you as a leader to pick up the phone and make that call. It's important that you understand what happens when you make that call and what sort of questions will be asked. I'm not necessarily stating that you need to make an appointment, but what this will do is it will lower the barrier for other individuals to call. When you can tell someone what sort of questions they'll be asked and what it's like when they make that call, it increases the likelihood that they will make that call, and it reduces the stigma around making such calls. We want to introduce the idea of work accommodations, if these are possible in your workplace. However, it may not be best to go into detail in this initial meeting. This may require a better understanding how their situation is impacting them. It's also important for you as a leader to understand what are the accommodations that your workplace can provide. What are the things that you know that have worked in the past and may be supportive going forward? We want to be able to set up a follow-up meeting. We want to identify specifically what could be done to accommodate the situation. And during that follow-up meeting, really check in about what could be overwhelming for that employee. It's important to create an action plan or strategy that may be more productive if tackled in a follow-up meeting. That initial meeting is really to clarify and acknowledge that there's been a difficulty that's been identified, to provide and establish a stronger relationship with your employee, as well as to open those lines of communication to have a clearer understanding of what the individual is experiencing. We want to keep checking in. Although you shouldn't hound an employee, it's important to follow up and continue to check in at regular intervals. The check-in is a relatively simple and straightforward method for addressing it and keeping an eye on the health of your employees. It fosters open communication and prevents issues from going unsupported and increasing in severity. It's important to recognize that the check-in can be really good when we have been able to clearly identify struggles of our employees and we recognize where those shortcomings are. We can also use the check-in just to ensure we're regularly communicating with our individuals and having a clear understanding of what the challenges they may currently be experiencing during this pandemic. Navigating mental health performance-related issues can be a challenge during normal time, but the stresses we are all facing during COVID-19 can make it even more challenging. But it's more important now than ever that people managers are able to identify employees who may be at risk and take appropriate actions to support them. Here are some final things to consider as people managers, helping to support the mental health of your employees during the pandemic and beyond. As much as you have a very important role to play, there are limits. You're not a psychologist or therapist. You can only describe your observations and communicate the supports and resources available. But ultimately, it's up to your employees to communicate with you and accept the help that is offered. Be reasonable with your employees and yourself. Managing mental health is not about lowering your expectations of your employees. It's about making those expectations clear and reasonable, making sure that we can be flexible and meet the needs of our individual staff in a really changing environment. We want to make sure to hold ourselves accountable to reasonable expectations as well. So there's a number of great digital resources out there. Lumino is one of those that this is provided by Sun Life, and it's available to all Canadians. On Lumino, you'll find information and resources to support health, including a library of COVID-19 related articles. And no content is constantly being added. There's also a stress and anxiety guide and a resource focused on mental health information and resources. So this is a curated website in which the information has already been vetted and also provides not just an article, but also lots of provider resources as well. There's also Sun Life resources. So we have a workplace mental health site where there are sponsored resources, plan member resources, as well as bright papers on thought leadership. And you can certainly access that through the web as well. Finally, Sun Life has developed manager training videos. These are a suite of 5 online manager training videos. Through these self-teaching video modules, your people leaders can learn to identify potential mental health issues in your workplace, communicate effectively, and help build a healthy environment, as well as to identify and address stigma related to mental health issues. Again, this is a free resource that is available both in English and French to all Canadians. Finally, Sun Life has developed a COVID-19 resource website where employees can find important information and updates related to COVID-19, as well as tip sheets to help employees balance work, life, and family during these times. The information on the website is updated regularly, so check back often for the latest information. It's important as a people leader that we recognize that accessing curated, scientifically valid information is paramount. If you're unsure about the information that you're providing, please go forward and check that information against other resources. Looking at resources like the World Health Organization's Mythbuster website can be extraordinarily helpful. Looking at other websites that help us to understand what the science behind these things are is incredibly important.
Wow, Carmen, thank you very much. I want to say how helpful it's these little words I'm writing down, practical and insightful. That this has been, I mean, for me, but I'm sure as others, as managers and people who deal with people, really breaks it and is thoughtful in a way that haven't seen before. Trying to do, folks, is I'm actually just going to go right to the questions here, Carmen, because there's quite a few here. Want to enter your
I'll do my best.
Enter your questions in Slido. You can also put your hand up here if there's time afterward. These questions were presented before the presentation when people register. You folks going to take certain liberties here as well in modifying the questions on what was said, but if it's your question and I haven't addressed it properly as well, please let me know. So the first question here is that we are all speaking intentionally / positively about mental health in and for workplaces. Can employers ensure they are acting on their good intention? And Carmen, I'm going to actually build on that to say, because you provided so much here, right? I was taking notes about communicating as first responder, red flags, using that language of performance evaluations, and looking for those red flags. But I'm wondering, that's a pretty broad question. I think you've addressed it all, but it is still this element of remote work, right? Like, is there anything you could kind of comment on when you're not in person, or sometimes, so much of this happens over phones and you can't, read the signs?
Absolutely. It's important to recognize that anytime we're not face-to-face with someone, we are at an increased risk of miscommunication. So making sure that as a people leader, you're entering into any conversation in a very tentative manner. You're not making assumptions. You're not saying you're doing this and this is because you're doing that. It's really important to use statements like, help me understand, or I've noticed the following, or how are things going for you? And recognizing that if an individual you're meeting with them through a website like this, it's important to recognize you're not going to get a full picture of them. Asking people, how are things at home? What are the challenges with working from home for the individual? These are all really important. It's also important to recognize that if you had a really strained relationship with an individual before you started working from home, that is not going to magically resolve. It's also important to recognize that if someone's not as comfortable talking through a web-based support, talking on the telephone can be really helpful. If you know that individuals are anxious, letting them know in advance. I'd like to touch base with you later this week. The topics I want to discuss are, how are you doing? How are things at home? How's your work demands? Giving people a little bit of an information prior to having that call can help to reduce their anxiety. Recognizing that one-on-one conversations are important, but it's also important to have those group conversations. If people are not seeing their colleagues, having an icebreaker or a team meeting or huddle to just do something fun or engaging can be important to continue to build that camaraderie, especially for individuals who may be feeling isolated. I've recognized during COVID that, some of the university students that I've worked with and some of the elderly or older individuals, they've been working at home by themselves for months. They've not seen anybody. They've not interacted with anybody. So giving people the opportunity to have a coffee chat and connect in a social way may be helpful, recognizing that, again, your pre-COVID culture is exactly what's going to determine what it's like during COVID as well.
Yeah, thanks. And I mean, it's just a helpful reminder, right, that it doesn't change. I'm going to go to the next question, but I'm going to add another little piece to this, Carmen, too, that I don't know, and if it's not, sort of slide this in, let me know. But when you talked about, being specific and observable, those changes, right? And so many times, you can tell when someone's underperforming, Carmen, but as this goes on and on and on, I mean, any one of us line and those, across the country, and so many colleagues and friends we know, it's the overperformance, that we've been going flat out for so long. And I know this isn't an easy question to and thoughts around that, or how we can address and think about that would be appreciated. Yeah.
I think it's really important to recognize that boundaries are vital to our long-term success. So it's easy if you have to roll out of bed and just walk next door and you're on your computer and you're at home and you think of something and you can just sort of do a couple more notes, or you're thinking, I don't have to put in as much effort to get ready or travel, so I can spend more time working. you're not making more during this period. You have a contract with your employer, and you as an employee have a contract of what your expectations are. Making sure that you adhere to those expectations, because otherwise we're dealing with ideas of burnout and ongoing fatigue. Being a people leader and recognizing that you're getting more out of your staff, that is not sustainable. If what you want is a long-term, actively engaged level employees, making sure that you say to them, if you're flexing your hours, okay, but I expect you to stop working. We cannot, reimburse you for when you wake up at 3 in the morning and are thinking about work. Recognizing the limits becomes really important, and encouraging people to understand that self-care is what will allow you to get that work done. The better you sleep, the more you're able to go for a walk or relax or deal with the things in your life, the better you'll be able to be effective in the job that you're doing. So that discussion around expectations and boundaries is imperative so that everyone can stay as healthy as possible.
Thank you. I'll remember. Yeah, I'm not getting paid at 3 in the morning. It's a good reminder, but I think it's absolutely valid. Carmen, the next question was about helping. We're at different phases and stages across the country, and it's this whole idea of returning to work. Sometimes, means returning to a physical office, sometimes hybrid. Is there any, thoughts or what's some current thinking around that?
The reality is we are all being forced to become more comfortable with uncertainty. There is a lack of clarity. We know that until there's a vaccine, that we will continue to have flare-ups, and there will be ongoing adjustments. So for individuals who have maybe pre-existing health conditions, that they're living with someone that's immune compromised, recognizing that everyone has a different experience as well as a different level of heightened anxiety around this condition. It is a serious condition, and even though you as an individual or a people leader may be more comfortable, recognizing that your level of comfort cannot be an expectation of your staff. So making those clear expectations becomes really important, as well as continuing to follow what the medical advice is by the government or the provincial health leader in your region. Continuing to check in with what that information is. Like I said, looking at curated resources is the most important. Unless you are a medical director, I would really encourage you to look and get that information from a recognized professional and not making those assumptions yourself, as well as recognizing that just because you feel some way does not mean the rest of your staff are going to feel that way either.
And that's really helpful as well. And you've addressed some of this that leads into the next question. The making assumptions, you said, talking about your own experiences. The question is, can you speak to the importance of leadership and leading by example in health and well-being? What are some best practices? So I heard you say not making assumptions. I've heard you say, even talk about your own experiences, because that opened the door. Is there anything else Ken or would like to add?
I think, leading by example includes things like shutting off your computer at a reasonable hour so that your employees aren't seeing you online, not sending emails late in the evening in which your employees may feel that they need to respond, making sure that one thing that I've noticed consistently is we're ignoring people's lunch hours. If you are in a national organization, recognizing that the individuals you're meeting with, they need to have that lunch hour. Encouraging your staff to take reasonable breaks, as well as to really provide an example of that in leadership and say, I'm not available for this half an hour, or I'm going for a walk every day at 2 o'clock. And, providing that sort of leadership is incredibly important. And when I talked about sharing your own examples, I don't want you to start, using your staff as a therapeutic resource to dump on, but it's really important to have healthy boundaries. It's okay to acknowledge this is a challenge for me. These are the types of supports that I've gotten. But recognizing that once you've said something, you can't take it back. So ensuring that we say things in a balanced manner that can provide validation without disclosing too much to an individual.
I like that idea of balances as well, Carmen. The next question, it says, at the beginning, the first slides mention costs. There is no EAP or it has been maxed out, other resources.
Right. So if there Yeah, so it's important to look at what are the free resources that are available to you. Now, the federal government has partnered to create some counseling resources for individuals. Provincial authorities and provincial organizations such as the Psychological Associations or College of Social Work may also have some resources available. If individuals don't have the finances to be engaged in individual therapy, they may want to meet with their family physician to find out whether or not their health authority provides any open counseling. The other option, of course, is online. There are online resources such as Mood Disorders Canada has a My Anxiety Plan. There's the Bounce Back program. There are a number of free online supports for individuals as well who may be coping with anxiety or depression.
Thanks very much. Question says, through the summer and into the fall, we support parents, particularly women, with the strain and mental health issues they are experiencing.
I wish I had a better answer for that. We know the research right now is very, very clear. Women and single parents are marginalized more than other groups during this pandemic, recognizing that if you are responsible for childcare, that you cannot put your 4-year-old in another room and attend a meeting. So it becomes important to recognize that the challenges are real, that the challenge of you as an employer are going to have to decide, is it more important to retain a good employee in a situation that is far beyond their control? Or is it more important to get really frustrated and have inappropriate expectations of them? This is a global pandemic, and for individuals who are not facing some of those challenges, I want you to think of what it would be like if you were to really consider the reality of people who don't have childcare because there is no childcare available. What does that actually look like for them? And really use those skills of empathy in order to understand, and then work with those individuals in order to support them. We know that employers who have to hire new staff or train new staff, that is a huge impact on an organization. So retaining good staff, in the long term, you will be much further ahead, as well as the relationship that you build with that employee who understands that you really have their back and are willing to invest and support them.
Thanks. And again, Carmen, that's great insight, because there is also, a business reality, but when you frame it in terms of, rehiring or retraining as well, that's something to keep in mind.
And right now, hiring and training individuals is extraordinarily complex as well, right? And so if you have a good employee, this is a chance for you to reciprocally invest in one another.
Indeed. Thank you. I'm just looking, the next question, Carmen, is, do small business owners and entrepreneurs ensure that they are not only looking after the well-being of their employees, but themselves?
I think that small businesses are really trying to do everything, and that's incredibly difficult. Your own self-care is important. If you are not taking care of yourself and setting limits and boundaries, nothing will work. I recognize at the beginning of the pandemic, we saw especially restaurant owners and small individual restaurant owners trying desperately to keep their staff and keep things going no matter what. Recognizing that this is a long-term reality becomes really important. Acknowledging the limits of what you can do. Continuing to get as much expert advice as you can is important. Connect with your bank, connect with other business leaders, connect with individuals through this network, find out what they're doing. Continue to be involved in understanding what is the government in your region being able to do. Reach out to your MP, reach out to your MLA, find out what the supports are there for you financially as well as emotionally. It becomes really important, and setting those limits and setting that example for your staff is important. This is clearly a marathon. And we're losing lots of businesses along the way. So recognizing that if you throw everything in right now, you're not going to be able to continue to sustain that effort.
Okay, so I've gone through the questions on Slido. I do see a hand up here, folks. We're going to try a little bit of this, and Rebecca, you'll have to work with me. If others have questions, please do. There's a big hand. It's the one on the very right-hand side. So you think I know this by now. I see.
Someone named Helen just raised her hand. I've unmuted her as well.
Okay, Helen, good afternoon.
Good afternoon. I was just checking my buttons, but I have a question I could form, which is how do you distinguish between somebody who is, how do I put this, is not in a place where they can actually accept help or take advantage of the resources that you provide, and how do you start to say, you know, this is not something I can cope with? Where do you turn at that point in time? Do you just go into the sort of disciplinary route, or, and
so
you know?
Anytime, yeah, what I encourage all leaders is to start with this as a performance management issue. Even though mental health may clearly be underlying what's going on, we as an employer, our job is to really look at those observable and measurable outcomes. And so the conversation would start with really outlining, these are the things that I'm seeing in the workplace, and this is what these are the changes that I've seen in your work production. Help me understand what's going on. And if the individual is not receptive to that, then you have to do, really the only option is to continue down that performance management path. Because again, if the individual isn't saying that there's any issue going on, we can't be prying into that. So generally what happens is, as we go down that performance management path, and as we find out more about what they're needing, and we try to put in supports and those sorts of things, the individual will either develop some insight and see their family doctor, develop some insight and disclose or seek help, or they will continue to be combative, and then frankly your only option is to continue to performance manage.
Okay, thanks.
Sorry, I wish I had a better answer.
It's the answer we have, right? Yeah.
Yeah. But again, really sticking to those observable metrics is really important, and then that way it's not a negotiation, right? If you've noticed 30 different problems, and you've noticed these specific errors, and you've noticed the person has come in late on the following dates, that's what's going to be the meat and potatoes of that conversation. It's imperative that you prepare for those conversations by having documented what you're seeing, because all we can do is present what we've observed and then allow the individual to provide feedback on what's going on for them and why those things may be manifesting.
Awesome.
Okay, so folks, I'm going to allow you, I'm going to ask a question and allow one more time. I'm doing this because it's the hands up the side. And Carmen, just because you've been so fantastic, and I appreciate this is sort of crystal balling, or sort of, because we're all there at this precipice of this, we've never been here before and all these cliches. But if you were to, because you're so practical and concrete and living with this uncertainty, what do you see happening in the next year, sort of in this world of work and mental health, and as we continue to negotiate this space? Is living with uncertainty just something we have to do, or what are the tidbits of your advice within that?
The first thing I would say to everyone is stop holding on to your holidays like this is going to resolve and you're going to get to go to the beach next month, right? And really, a lot of us are doing that, right? We're holding on thinking something's going to change. I'm going to get to that white sand beach right away. Stop doing that. Take your holidays. Take a break, step away from things, encourage your staff to do that as well. Recognizing that vacations are going to look probably very different than they have historically, but the need to do them hasn't changed. So that's the first real practical thing is use your holidays and encourage your staff to use their holidays. Really recognize that everything and nothing might change, meaning that yes, you might go back to your office, but it may not be the same. Yes, you may continue working from home for the foreseeable future. We just don't know. What we do know is that if you are not sleeping, if you are not eating, if you are not having some enjoyment, and if you don't have healthy boundaries, none of this will work. So recognizing that we need to focus on the aspects that we can control and the aspects that we can change, and really acknowledge those things that may be causing us anxiety, but not focusing on them. If we can't impact them, continuing to zero in on them will not be helpful, right? If you are in vaccine production, yes, zero in and focus on that. If you are not in vaccine production, really recognize that there's probably very little you can do right now other than continuing to work in the way that you can, come up with ideas that might make things easier for you, and focus on your own self-care.
Thank you so much. And I think that's like a fantastic, positive, realistic note to finish this on. I thank you for your time and your insights. I thank everyone here today for joining the line. We do follow up, right, Rebecca? We'll come out with a presentation, the slides, and Carmen, if you could be kind to send that direct link, that would be appreciated as well.
Absolutely.
Everyone, as we continue to manage this and deal with mental health through this, and I wish you all a good rest of the day. Thank you very much.
Thank you so much for having me.